Sudden death syndrome is a condition associated mainly with commercial broiler systems where apparently healthy birds suddenly die for no apparent cause. It tends to occur from 72 hours after hatching up to 12 weeks of age, with the greatest losses occurring between 2 to 3 weeks. The condition is also referred to as flip-over, acute death syndrome, death in a good condition, heart attack, or lung edema. It is associated with fast-growing broiler birds, and it therefore should not be a problem in organic and extensive free-range systems that cause breeds suited to these conditions. There are no clinical signs or unusual behavior until less than a minute before death. Then there may be a sudden squawking, loss of balance, convulsions, and frantic wing flapping. Birds tend to die on their backs with one or both legs raised, hence the term flip-over. At postmortem, birds show an enlarged, pale liver, and kidneys may be pale and lungs congested. It has been shown that in medium to fast-growing broiler types, high specification ratios tend to increase the incidences of flip-overs and leg curls. In systems whereby birds are fed for slow growth, this condition should not be a problem. There are a number of factors that influence this incidence. Management factors that cause stress, such as high intensity light, high stocking rate, and absence of exercise, may induce or contribute to the condition. It has been suggested that bright sunlight may be a predisposing factor. Apart from the provision of shade, little can be done to protect free-range birds from intense sunlight. A number of nutritional factors have been implicated, including diet texture, in that feeding pelleted feed can result in high growth rates and increased risk of sudden death syndrome. Diets high in glucose as opposed to high starch have also been implicated. Control and prevention of sudden death syndrome in our broiler birds. Lowering carbohydrate energy intake by changing food texture or density, or management methods such as feed restriction or long dark periods have been suggested to reduce death in broiler birds. Higher incidence has been noted in folks fed wheat-based diets compared with those on maize diets. Number 2, use diets with 5 to 7% reduction in nutrient density. Number 3, supplement feeds with potassium salts. Number 4, supplement wheat soya diets with sunflower oil. Number 5, dietary fat restriction from 0 to 7 days. Number 6, lowering the energy to protein ratio of finishing diets. Number 7, restricting food of ad-lib fed flocks by 30 to 40%. Feed a low protein, stock low energy diet during first 14 days. Given that this is a sudden death syndrome, there is no treatment for such condition. Thanks for watching my video. Consider subscribing to this YouTube channel. Hit that notification bell such that every time we upload a video, you get to know. Bye bye.